Minister, the BC Nurses Union says the decision yesterday to require all healthcare staff to be immunized could lead to a crash in the healthcare system with those not immunized losing their jobs. What are you going to do to prevent a crash in the healthcare system? And can you assure people that if there are a lot of people removed to the system due to the fact they won't be immunized, you're going to find some way to replace those positions?
I think what we're doing is what we've been doing really since the beginning of the pandemic. Healthcare workers were in first priority to get immunized. A very high percentage of healthcare workers have been immunized, and we want everyone to get immunized. And there's going to be, and that was announced not yesterday, but some weeks ago in long-term care and in assisted living. In long-term care and assisted living, you're talking about roughly 49,000 people, and we have, we're going to work through to October 12th to ensure that the maximum number of people are immunized equally. In acute care, for example, circumstances where people frequently, as you know, there are many people in acute care who resemble the health status of those in long-term care, who are in alternative level of care beds in acute care, who are effectively in long-term care while being in a hospital. The same risks and circumstances apply. We're in a pandemic. It has very high risks in the healthcare setting. And we have these very effective, very safe vaccines. And so there's an expectation that everyone who works in the healthcare system is vaccinated, because the level of risk in the healthcare system justifies that. Hundreds of people died in long-term care. And so in other venues and other settings, that hasn't been the case. But in long-term care and assisted living, and indeed in acute care, we've seen significant outbreaks of COVID-19, and that's why it's very important in this time, given the risks of COVID-19, the risks of the Delta variant, and the statistics that we've just talked about, that we're asking all healthcare workers to be vaccinated. That is not without challenges, and we do not have not taken, do not take that decision lightly, because, as you say, there may be people who choose not to be vaccinated and won't be able to be available for work. But that said, I don't think we can have a situation, given the seriousness of COVID-19 and its impact, where people are working without vaccination. That was the conclusion. That's the direction from public health. It's the right direction, and we're going to work very hard with the BCNU and the Hospital Employees Union, the Health Sciences Association, the doctors of BC, with midwives, with ambulance paramedics, with everyone else, to ensure that everyone gets vaccinated.
Richard, did you have a follow-up?
I get all that, but we don't know how many, not to pick on the nurses, but they're part of the healthcare system. We don't know how many will get immunized. Based on what Dr. Henry said yesterday, the belief now is it's around 80%, which means there's about 8,000 nurses who are not immunized. Hypothetically, we could have up to 8,000 nurses no longer on the job post-October 26th. I think we all assume that number will go down. But even so, you haven't addressed the issue of what will happen if we're 2,000 nurses short, 4,000 nurses short. We're short in other parts of the system, including paramedics. These are people who are already under immense pressure. What is the province going to do to address those potential shortages due to the vaccination policy?
Well, I think it's important not to speculate too much about the numbers. We know that the massive majority of healthcare workers have been immunized everywhere in BC. We know that the average, not of healthcare workers, but of everyone else over 12 is now 86%. The average of everyone over 18, which includes this category, is about 87%. Of people in BC. That's the average have been immunized. So I wouldn't use 80% as a baseline, Richard. That's what I think the point I'm making. And if 87% of all people in BC have been immunized, the number for healthcare workers will be significantly above that. That said, we don't want to lose anybody. So we're going to be working with people to ensure that the maximum number of people are immunized. And we do have to prepare, and we are preparing to deal with the situation after October 12th. But the reality of it is this, and healthcare workers know about the importance of immunization. It's central necessity in these times. You see it in these numbers. They're living it every day. Nurses talk to me who work in ICU regularly, email me this, talk to them about the situation of nurses in ICU dealing with unvaccinated people. We don't have to tell healthcare workers anything about COVID-19, and I'm very encouraged that the rate of uptake is going to be very, very high. But you're right, we're going to have to prepare for circumstances should people leave certain positions, and it's why, in part, we've continued to add healthcare workers in this pandemic. Today we're adding ambulance paramedics positions. We did so earlier this year. We've done so multiple times over the last number of years. We've added, since we announced our healthcare worker program in long-term care, 5,000 workers. And we're going to have to continue to do that work. And it's regardless of the issue of vaccination, by the way. We continue to have to build out and hire more healthcare workers in every part of the province, whether it's Interior Health or Northern Health. And we're just going to continue to do that.
Hi, Minister. I just wanted to follow up on what Richard was asking, because you said, yes, you need to do some steps and that you're bolstering and you're working with the BCNU. But people who are really concerned want to hear something sort of more tangible when it's just weeks away that this mandate comes in. And, looking at Dr. Henry saying up to 5% are people who, of the general population, are people who are not ever going to get vaccinated. And that, as Richard said, could be thousands. So what's going to happen if thousands decide that they will choose not vaccinating over having their jobs?
Well, I think what people expect is that everyone to be vaccinated in our healthcare system, and that reflects the needs of the COVID-19 pandemic. And our leaders in providing scientific advice, Dr. Henry, Dr. Gustafson, and others have recommended it, and we're proceeding with it. I think the idea that you wouldn't proceed with such an idea because it's too hard to do is not the right idea. It's not our approach to COVID-19 at all. We need everyone in healthcare to get vaccinated, and people in healthcare, I think, overwhelmingly understand that. And so obviously we're preparing for that, but our key goal right now is to ensure that we absolutely have a maximum amount of people vaccinated. And the reason for that isn't just to deal with what will happen on October 12th in long-term care and assisted living, what will happen on October 26th in the community and acute care. It's to ensure that everyone gets vaccinated, because that's how we keep people safe. So, when you talk about people's concerns, I think people would expect that workers in healthcare are vaccinated against COVID-19, given what we've lived through together in the last 18 months. And we're working hard to see that that happens, to make sure that that happens, to make sure if people have questions that they're answered, and to work with them to address the situation. So I'm not going to speculate. We're obviously preparing for that day. But the main preparation we have to do is what everyone expects, is that everyone in long-term care and assisted living gets vaccinated, who's directly involved in patient care, I should say, and that people in the healthcare system who are involved in direct work with patients or clients, depending on the circumstances, get vaccinated. And that's what we're doing. And you're quite right. It's not easy. But like everything else, we're making preparations in advance and working hard to ensure that we're ready for those days. And this is, we got questions yesterday, and we have questions about third doses. We don't know with respect to the need for third doses, but what we do know is that we need to be prepared and have our system in place, so if that decision is made at some point in the future, we'll be ready to go. We don't know when children 6 to 11 may have access to a vaccine against COVID-19, but we need to be ready, and we have an outstanding team led by Penny Ballum getting us ready. And so those are the things we're doing, and of course we're preparing for this, but the main goal right now is the public goal that I think just about everybody agrees with, that everybody in our healthcare system needs to be vaccinated, and we're working hard to see that that happens.
Lisa, did you have a follow-up?
Yes, and I'm not at all insinuating that you shouldn't do it. I'm asking what's going to happen if the worst happens. We heard about Langley ER that they were down to 50% of their staff at one point this week and were having to divert ambulances and divert people. And if that's happening before any staff are leaving because of the mandate, I'm just like, you're saying that you're making preparations. Is there anything tangible you can tell me that is being done for the worst case scenario of how our hospitals will be staffed if the worst case happens?
Lisa, what's disruptive? And every Thursday we publish the numbers in long-term care and assisted living of outbreaks. And you're very familiar with that. You look at it every week, I know, and you'll see the number of staff people in the course of the pandemic, especially pre-immunization, who got sick with COVID-19, all of which had a profound effect on the delivery of care. It's not just the risk that some people who are not vaccinated may leave. It's the risk to health human resources of COVID-19. And we've seen this for months and months and months and months. And so the reason why we're taking this step is to support and protect the healthcare system and all of those in it, including those working in the healthcare system. That's why we've taken the steps. And we're obviously, these decisions were not taken lightly. They're difficult decisions to take because the impact on individuals can be significant, but so can COVID-19, so can its impact on particular facilities. And I think we have to continue, and I hope we will continue together to do everything we can to stop the transmission of COVID-19 in facilities. But you've seen it, and I don't need to list off the facilities and the cases. In the case of Vancouver Coastal Health, hundreds of staff went into facilities to support them, and those were real staffing challenges. I know from personal family experience what it can mean when COVID-19 comes to a facility. So these are necessary steps, and the impact on health human resources is not just the potential risk, but the benefit of ensuring that those facilities are safer.
I do. Following up on Lisa's question, you said regarding potential staffing issues if nurses or healthcare workers decide to walk away from the job. You said preparations are being made. You don't want to speculate, but preparations are being made in case. What do those preparations look like? And if we can get an answer in French, please.
Well, just to say, I think what I said in the response to Lisa's question is that COVID-19 itself has had a significant impact on health human resources everywhere in BC. When there are outbreaks, it happens in every single case. There's an impact on health human resources. So reducing outbreaks and ensuring everyone in the system is working has a positive effect on health human resources in that sense. But of course, you make a decision like that. That's why we're going through it systematically. We're reviewing every facility around BC, what the level of vaccination is, what effort we have to make to get to raise that vaccination level if it's too low. But I think that like a lot of things in this pandemic, what we're talking about is difficult but necessary. Necessary for health human resources, necessary to protect patients, necessary to protect staff. And as a result of that, we're preparing for the circumstances that might exist if some people, of course, choose not to get vaccinated and choose not to continue to work in their jobs. That's a challenge. But so is the challenge of COVID-19 when there are outbreaks in communities and people are off for significant periods of time. And so we have to balance that out, and we have to be ready. And it's not going to be easy, but we'll be ready.